Hi, my name is Kent Johnson. I work for LA Sports Performance Care. This is Gigi McMillan, my model, and we're going to demonstrate kneeling hip openers today. And the purpose of kneeling hip openers is to increase hip and knee range of motion. Most of us are actually very tight in our hip joint as far as too much hip flexion, too much pelvic flexion, and too much knee extension. Okay, and the muscles involved there, the iliac is, some of the psoas, and mostly rectus femoris and vastus lateralis. And what we're going to do is we're going to actually place a stability ball next to a stationary object. Okay, the ball can't be rolling around in the middle of the floor. And then if you have an Eric's pad, you put it in front of the put the Eric's pad in front of the stability ball. If not, then a couple of yoga mats or a couple of pillows, but you have to put something in front of it, otherwise you're going to compress your knee. Okay, now kneeling hip openers is just a fancy term for stretching the hip flexors and stretching the quadriceps. But we want you to focus on the hip and the knee joint. Okay, so what Gigi's going to do now, she's going to go ahead and she's going to stretch her right hip flexor and right quad, meaning she's going to focus on the right hip and right knee. So whatever side you're stretching, you have to hold on to a stool or to a chair or a couch, whatever the case may be. Joints and muscles won't let go if you're too busy dealing with instability. Okay, and if you notice, she put her knee right in front of the center of the blue pad here with her foot on top of the stability ball. Her heel is right behind her glute. Okay, and she's actually aligned. Again, whatever side you're stretching, you have to hold on to something. Her spine's actually aligned. She's looking straight ahead. Okay, if you feel any tension in the knee or it hurts, then that most likely means that you're not aligned properly. If you actually readjust and it still hurts, then you need to not do this exercise until you come see us. Okay? So her left foot is actually aligned with her left knee and is lined up on her hip. And again, everything is straight. She's going to now engage her right glute and just push her pelvis forward. And that's going to give you a nice stretch. Now don't overdo this stretch. Okay? You want to kind of tease it. All right, if you actually push too hard, you may actually pull a muscle. She's only going to stay in this position for 30 to 45 seconds, and I need you to do it 2 to 4 times on each side, focusing more on the tighter side, and most likely you will have one side that's tighter than the other. Okay, when she actually comes out of it, she's going to push her stool out to the side. She's going to go to her hands and knees. Okay, and then she actually walks away. Okay. And then again, whatever side you're stretching, you hold on to something, okay? And then she pushes her forward, engaging the glute, and she's lined up properly again. Okay, so say for instance she's done this for 30 or 45 seconds, she pushes the stool to the side, she goes to her hands and knees, okay? And you just step forward, Gigi. There you go, just step forward, okay? All right, and what I would like for you to do is try to disengage from the ball as much as possible. Don't leave your foot up on top of the ball, okay? Otherwise, if the ball rolls and you fall down, then you're going to twist your knee or your hip.